You got the femur here, the tibia here, the fibula here. Fibula is this little guy, little bone off to the outside. It doesn't really do any support, weight support for the knee itself. Really all that happens right in here. And inside the joint, you've got two different surfaces that are covered in cartilage. Cartilage is a really slippery substance that keeps the bones from grinding together. It's a really important cushioner and lubricating surface for the knee to work smoothly. Looking on the other side, we're going through a couple of the ligaments that are kind of deeper in the knee, like the ACL. If we're looking at the front here, the ACL is this guy that goes really deep in there, front to back. Everybody heard of ACL tears probably, right? So ACL tear happens when this guy rips. PCL is back in that same area. There's a number of really important ligaments within the knee that help provide its stability and support. And there can be certain injuries we'll get into soon where those can tear. There's the PCL. Here we're looking we pulled the kneecap off and we're looking into these cartilage surfaces. There's a lot of cartilage in the knee. It has a large range of motion. It can do flexion and extension to a large degree, and so you need all those surfaces covered with cartilage. So far so good? We're going to the meniscus next. Everybody heard of the meniscus? The meniscus is this guy that's highlighted in green right here. That's the medial meniscus. So you have one on the inside of the knee, and then you have one on the outside of the knee as well. They sit there inside the joint and they act as a cushion. So they help to protect those cartilage surfaces. When you come down hard like this, something has to soak that up. If your muscles don't do it, it's the meniscus' job to try and take that kind of blow, that impact, so that you don't just have cartilage knocking against cartilage. Okay? All that is surrounded and covered by a synovial membrane, so the knee overall has like an envelope of the synovium all around it. So the knee compartment isn't really divided up. It's all one compartment, and within there is joint fluid. So within that compartment is a lot of joint fluid. That helps to continue to lubricate the cartilage and helps to protect the meniscus as well. And then all that is covered by this tougher articular capsule of the knee that kind of holds everything together. So far so good? All right, excellent. There's additional ligaments on the outside of that articular envelope there. And you can see here too, we've got bursas. Here is a bursa. Those are like little cushioned sacs. They protect the ligaments and the tendons from rubbing against bone and other critical areas. There's a number of different spots that have bursae in the knees. Here, there's some here. And those help to make sure that the knee does not end up with extra friction. Extra friction means inflammation. Inflammation means swelling and pain. Around the joint and attached to the joint, there are a large number of different muscles, and those muscles are responsible for movement and stabilization of the knee. The knee's not really made to just function on its own so that your weight goes straight into the joint. These muscles take up a lot of that force. So the knee provides movement, but the muscles are what actually absorb a lot of impact and allow the body to not put that force straight into the cartilage, the meniscus, and so forth. That way you don't have that knocking together sensation when you have an impact. So when these muscles, all these different muscles, when they get weakened, more and more of the force does go into that joint, which then can lead to more damage. Okay, we're all the way up to the big old quad muscles now, looking at the front of the leg. These guys here. Questions so far? I know that's blazing fast, but this is where I usually have people starting to nod off a little bit. But it's important to know what those parts are as we start talking about the knee, because the next piece we're going to go to is some of those common injuries. And if you know what the pieces are and what they look like, you have a better concept in your head of what's kind of happening in that joint. What I see every day is the better people understand the injury, the better decisions they can make about what they're going to do with it, and even just daily activities.